Bismillahirrahmanirrahim. Rabbi zidni ilma. Keep your eyes on the stars and your feet on the ground. Assalamu alaikum everyone. My name is Dr. Sadia Rafi, and under the supervision of Professor Dr. Sara Afzal, today my topic of presentation is chlamydia. Learning outlines include the introduction, epidemiological determinants, mode of transmission, clinical presentations, level of prevention, recent updates, and multiple choice questions. Learning outcome. At the end of this presentation, participants will be able to describe chlamydia, its epidemiological triad, and its prevention and control. Sexually transmitted disease and one of chlamydia is one of the bacterial infections. Regarding WHO STIs key facts, more than 1 million sexually transmitted infections are required every day worldwide, the majority of which are asymptomatic. Each year, there are estimated 374 million new infections with one of 4 STIs, which includes chlamydia, gonorrhea, syphilis, and trichomoniasis. STIs have direct impact on sexual and reproductive health through stigmatization, infertility, cancers, and pregnancy complication, and increase the risk of HIV. Introduction. Chlamydia is a common STD that can affect both men and women. It can cause serious permanent damage to a woman's reproductive system and can cause infertility to fetal ectopic pregnancy. It can cause sterility in men. History. Chlamydia became first recognized as a specific STI in the 1970s, but it took until 1988 for it to become notifiable. Prevalence. Chlamydia is the most frequent reported bacterial sexually transmitted infection in the United States. However, a large number of cases are not reported because most people with chlamydia are asymptomatic and do not seek testing. It is the most common among young people. 2/3 of the new chlamydia infections occur among youth age 15 to 24 years. It is estimated that in 1 in 20 sexually active young women aged 14 to 24 years have chlamydia. Substantial racial and ethnic disparities in chlamydia infection exist, with prevalence among non-Hispanic blacks is 5.6 times to the prevalence among non-Hispanic whites. It is also common among men who have sex with men. Spread is by having vaginal, anal, and oral sex with someone having chlamydia. If someone had chlamydia that wasn't treated in the past, can still get infection again. Pregnant women can transmit it to the baby during childbirth. Talking about the epidemiological triad, agent, host, and environment. Agent is Chlamydia trachomatis. It is gram-negative bacteria, obligate intracellular bacteria, and live in the cytoplasm of the epithelial cells. It survives by replication that results in the death of the cell. It is usually the two form its life cycle, which is alimentary body and then the reticulate body. If we see the chlamydia life cycle, it is the alimentary body which is attached to the surface and enters in the cell within 0 to 6 hours. Alimentary body leads to the inclusion within the cell, and then it converts into the reticular body just after 6 to 12 years. Then there's a replication start inside the cell, and which leads to after 48 to 72 hours can cause the death of the cell, and it is released. Pathogenesis. Disease pathogenesis is a complicated process that involves exposure to the organism and infectivity, survival within the host cell, virulence associated with specific strain types, innate and acquired immunity, and the host genetic susceptibility to the infection and disease. Chlamydiaceae family, the species that cause diseases in humans. If you see the species, is the Clostridium Chlamydia trachomatis, which has 2 variants, non-LGV, lymphogranuloma venereum, and LGV. And diseases they cause are the trachoma, non-gonococcal urethritis, pelvic inflammatory disease, conjunctivitis, infant pneumonia, and lymphogranuloma venereum. Then the second species is pneumoniae, which cause pharyngitis, bronchitis, and pneumonia. And third is psittaceae, which is cause psittacosis in humans. Talking about the chain of transmission, the reservoir is human. Risk factors include the adolescence, new or multiple sex partners, history of STD infections, presence of another STD, and the lack of barrier contraception. You can see that its risk factors are the cervical ectopy, multiple partners, men having sex with men, existing STDs, unprotected sex, and HIV positive patients. Transmission is sexual or vertical. Highly transmissible. Incubation period is 7 to 21 days. Significant asymptomatic reservoir exists in the population. Reinfection is common. Perinatal transmission results in neonatal conjunctivitis in 30 to 50% of exposed babies. Clinical features. Most people who have chlamydia have no symptoms. If have symptoms, they may not appear until several weeks. Even when chlamydia causes no symptom, it can damage the reproductive system. And if it's symptomatic, it is 1 in 10 men and 3 in 10 women shows the symptoms of this disease. Talking about the symptom, in men, it is penile discharge, burning or painful urination, and testicular swelling. And the women, it is vaginal discharge, burning and painful urination, and the bleeding between periods. This is the common symptom between both men and women, which is burning and painful urination. Trachomatis infection in men. But it is the most common is urethritis. It is one cause of non-gonococcal urethritis, NGU. Majority, more than 50%, are asymptomatic. If signs are present, required a clear urethral discharge and dysuria is there, and incubation periods variable between 5 to 10 days in symptomatic infection. And the complication in men leads to the epididymitis and the Ritter syndrome, which is a family of arthritic disorders that affects joints, eyes, urethra, and skin. Talking about this infection in women, it is cervicitis. Majority is 70 to 80% are asymptomatic, which has, if symptomatic, there are local signs of infection, which present includes mucopurulent endocervical discharge, edematous cervical atopy with erythema and friability. Urethritis, usually asymptomatic, and symptoms are present into dysuria frequency and pyuria. You can say this is the picture of a normal surface, normal looking cervix. And in case of chlamydia cervicitis, you can see the inflammation, redness, and discharge in it. So its complication in women, main basic complications is pelvic inflammatory disease, which cause the salpingitis and endometritis. And one of the exclusive feature is perihepatitis or Fitz-Hughes syndrome, is a chronic manifestation of PID and almost exclusively in women. It is just in women, not in men, because it is a complication of the long PID and the Ritter syndrome. You can see the acute salpingitis. These are the fallopian tubes, ovaries, and these you can see how thick adherence is in between it, between uterus and fallopian tubes and ovaries. As far as regarding infection in infants, perinatal clinical manifestations are including conjunctivitis or pneumonia. You can see by this picture the risk of passing bacteria in newborn through vaginal delivery. It can have via mouth, the newborn can have it, which can lead to neonatal pneumonia. It can also could have lymphogranuloma venereum, the serotypes L1, L2, and 3. And late onset neonatal conjunctivitis. And it occurs between 5 days to 2 weeks, obviously within a week or 2 weeks. And its infection in children, pre-adolescents, males and females could have this. They could have urogenital infections, which are usually asymptomatic, or they could have by this vertical transmission, and also could have that by the sexual abuse. Clinical syndromes caused by chlamydia trachomatis are in men, women, and infants. In the men, local infections almost same to all: conjunctivitis, urethritis, prostatitis, cervicitis, conjunctivitis, and it's almost same in the complications in men, Ritter syndrome or epididymitis, and in females, it endometritis, salpingitis, perihepatitis, that is syndrome, Ritter syndrome, and the chronic sickle due to arthritis could be there, and in females, it is infertility or ectopic pregnancy, chronic pelvic pain, and infants, it's rare. Untreated chlamydia may increase a person's chance of acquiring or transmitting HIV, the virus that can cause AIDS, that causes AIDS, basically. Talking about the levels of prevention. Primary prevention is health proportion and specific protection. Regarding primary prevention, it is around the individual level, society and community level, and the policy and environment. It includes 3 strategies area, different strategic areas. These are promoting public health policy, promoting a supportive environment, strengthening community action, promoting health personal behavior skills by providing information, education, and counseling, orienting health services towards meeting all the patient needs, specific health education program regarding safe sex, using condoms, reporting for early treatment, and strict compliance. All these factors further prevent transmission of the disease. Specific protection, there's no vaccine is available, but for the first time, a vaccine against chlamydia has completed a clinical phase 1 trial. Secondary prevention includes early diagnosis and prompt treatment. As far as the diagnosis is concerned, there is a number of diagnostic tests for chlamydia, including nucleic acid amplification, NATs, cell culture, and others. NATs are the most sensitive tests and can be performed on easily obtainable specimens such as vaginal swabs or urine. Urine is a specimen of choice for men. Chlamydia culture can be used for rectal or pharyngeal specimen, but is not widely available. NATs have demonstrated improved sensitivity and specificity compared with the culture of detection of at non-genital sites. Testing technologies includes the culture and the non-culture test. Talking one by one. Culture, it is the gold standard. Sensitivity varies from 50 to 80%. It's highly specificity, used in legal investigations and non-suitable for widespread screening. Regarding non-culture tests are the NATs, non-NATs, and serology. NATs are amplified and detecting organisms, specific genomic or plasmid DNA or RNA. FDA cleared for urethral swab for men and women, cervical swab for women, and urine for both. And different commercially available, these are the few names are given, which are available in the market. Non-NATs, these are direct fluorescent antibody, enzyme immunoassay, and nucleic acid hybridization. Regarding serology, it is rarely used for uncomplicated infections and results are difficult to interpret in it. As far as the CDC guidelines for the sexually transmitted infection, chlamydia infections, 2021. Chlamydia can be easily cured with antibiotics. HIV positive person with chlamydia should receive the same treatment as those who are HIV negative. Person with this infection should abstain from sexual activity for 7 days after single dose antibiotic or until completion of 7-day course of antibiotics to prevent spreading the infection to partners. Although medication will cure the infection, it will not repair any permanent damage done by the disease. If a person's symptoms continue for more than a few days after receiving treatment, he or she should return to the healthcare provider to be re-evaluated. Chlamydia infection infects can be treated with antibiotics. So these are the recommended regime for chlamydia among adolescent adults is doxycycline 100 milligram orally 2 times per day for 7 days. Or alternative regime is azithromycin 1 gram orally in a single dose or levofloxacin 500 gram orally once daily for 7 days. So like in pregnancy, azithromycin 1 gram in a single dose. Alternative regime is amoxicillin. In neonates, erythromycin or thiocyanate 50 grams per kg body weight or day orally divided into 4 doses daily for 14 days is recommended. And in case of pneumonia, erythromycin again 4 doses for 14 days. Alternative regime is azithromycin. And again, the recommended regime for infants and children are on the less than 45 kg based upon it, erythromycin, and more than 45 kgs, azithromycin, and 8 years, azithromycin and doxycycline are the main drugs. Repeat testing after treatment. Pregnant women repeat testing preferably by culture 3 weeks after completion of recommended therapy. And for the non-pregnant women, screening 3 to 4 months after treatment, especially in adolescents. Screen at next healthcare visit or consider test of cure 3 weeks after completion of therapy for anyone treated with erythromycin. EPT, expedited partner therapy. To help get partners treated quickly, healthcare provider can give infected individual extra medicine or prescriptions to give to their sex partners. This is called expedited partner therapy or EPT. Why to screen for chlamydia? Screening can reduce the incidence of PID by more than 50%. Most infections are asymptomatic. Screening decreases the prevalence of infection in the population and reduces the transmission of the disease. Screening recommendations for non-pregnant women are sexually active women more 55 years and under should be screened annually. Repeat screening of women 3 to 4 months after treatment for this infection, especially adolescents. And for pregnant women, screen all pregnant women at the first prenatal visit. Pregnant women aged 25 years and those at increased risk of chlamydia should be screened again in the third trimester. Partner management. Sex partners should be evaluated, tested, and treated if they have sexual contact with the patient during the 60 days preceding the onset of symptoms or diagnosis of chlamydia. The most recent sex partner should be evaluated and treated even if the time of the last sexual contact was more than 60 days before symptom onset or diagnosis. Prevention counseling includes a risk reduction. The clinician should assess the patient's behavior change potential, discuss prevention strategies, including abstinence, monogamy, condoms, limit number of sex partners, etc., and develop individualized risk reduction plans. Recent updates. In Pakistan, there is National AIDS Control Program, which was established in 1986-87. The heterogeneity and interlinking of high-risk injecting sexual behavior combined with low levels of HIV knowledge and prevention and high levels of other STIs. The few main objectives of national AIDS control programs are prevention of HIV transmission, safe blood transfusion, reduction of STS transmission, and the establishment of surveillance. World Health Organization Global Health Sector Strategy on Sexually Transmitted Infection 2016 and 21. This was based upon the strategy on the 2006-2015 and sets out some VN goals, targets, guiding principles, and priority actions for ending the sexually transmitted infections epidemic as a public health problem. CDC having chlamydia statistics shows you can see this rate, and these are number of years. Rates of reported cases among women aged 15 to 44 years by age group United States. And you can see at the age of 30 to 5, it is like this. And it is maximum in age group of 20 to 24 years, almost 4,000. Sexually transmitted infection prevalence, incidence, and cost estimation in the United States, you can see 1 in 5 people in the US have an STI. Total nearing 68 million infections in 2018. 26 million new STIs in 2018. Half of new STIs were among youth aged 15 to 24 years in US. And new STI, total near 16 billion is direct medical cost. Regarding fact sheet of CDC, women under 25 and older women with risk factors need testing every year. It is one of the documents on CDC regarding surveillance of chlamydia 2020. Now you can see the rates of reported cases by year in United States. This is the rate per lakh. These are the years. And you can see it around 1994 added to the National Notified Condition List. And you can see the graph, it's going upwards. The number of cases are increases every year. And it is the rates of reported cases of sex United States. These are the, again, the rate, and these are the men total, and these are the women. So large number of cases in women. This is the chlamydia rates of reported case by age group and sex United 2020. You can see the age group, and you can see its maximum at the age group in females at the age group of 20 to 24. Total number of females is also high, but this age group is having maximum cases, which is 20 to 24 years. Then the rate of reported cases among women aged 15 years by age group. Again, I have shown you already. You can see at the age of 20 to 24, maximum 4,000 cases. It is the proportion of STD clinic patient testing positive by age group, sex, and sex partner, STD surveillance 2020. You can see the red bar is showing man having sex with man. Blue is having sex with only one female and women. You can see the percentage and the age group. It is one of the articles which is the callers really do get chlamydia, how these marsupials could help humans battle the STI. In koalas, The chlamydia's ravages are extreme, leading to severe inflammation, massive cysts, and scarring of the reproductive tract. Because of these similarities, the trials that endeavor may have valuable clues for researchers across the globe who are developing a human vaccine. It's time for multiple choice questions now. Chlamydia is called the silent disease because it often goes undetected. What proportion of infected men and women have symptoms of chlamydia? 1 in 2 men and 4 in 5 men, 3 in 10 men and 1 in 2 men, 1 in 10 men and 3 in 10 women, 5 in 100 men and 1 in 10 women, 4 in 100 women and 5 in 50 women. No, the C is the correct answer. I have told you it is usually asymptomatic, but the percentage is 1 in 10 men and 3 in 10 women will show the symptoms of it. It is more prevalent in females. Among all STIs, chlamydia is the most common one. The highest number of cases are found in WHO region of Americas and WHO Western Pacific region. Which age group has the highest rate of chlamydial infection? 15 to 19 years old, 20 to 25, 25 to 29, 30 to 40, 40 plus.
Beta.
Yes, the correct answer is B. 20 to 25 years old is the most common one. All the following statements about chlamydia and trachomatis are correct, except a leading cause of ocular and genital infection. The organism grows well in the egg yolk sac. It occurs in two body form, alimentary and reticulate, a common pathogen of acute respiratory disease.
B.
No, the correct answer is D, because it is not a common pathogen of acute respiratory disease. All remaining options are correct, and the fourth one is incorrect. Which of the following antibiotics are most commonly prescribed for the treatment of chlamydia infection? Rifampicin and isoniazid, metronidazole, doxycycline or azithromycin, ciprofloxacin or ceftriaxone?
C.
Yes, the C is the correct answer. Doxycycline and azithromycin are the most common antibiotics which are used. Which of the following statement is not the distinguished feature of the family Chlamydiaceae? They are seen on grams. They are obligate intracellular. They cannot make antibodies. They consist of two form, alimentary and reticulate body.
D.
No, the correct answer is A. These are gram-negative bacteria. So this is not the distinguished feature of this family. So A is the answer. Chlamydia is one of the major pathogens that cause a sexually transmitted disease. What is the most common symptom of the disease that can occur both in men and women? Diarrhea and vomiting, mouth ulcers or sores, flu-like symptoms with high-grade fever, painful urination with charge.
D. D.
D is the correct. Which of the following specimen used for the diagnosis? Which of the following is the common specimen used for the diagnosis of sexually transmitted chlamydia infection that occur in both in women? Oral swab, cerebrospinal fluid, urine, skin biopsy, or blood?
C.
C. Yes, C is the correct. And urine is the specimen for both men and women. When do the symptoms of neonatal pneumonia in the baby start to show caused by Chlamydia trachomatis? In 1 week after the birth, 2 to 12 weeks, 5 to 10 days, 2 to 3 weeks, or 4 to 5 weeks after birth?
Alpha.
No, it is the within 2 to 12 weeks after birth, the signs of the pneumonia starts. The eyes in conjunctivitis starts earlier, pneumonia appears later. Chlamydia trachomatis is transmitted from the infected mother to baby through birth canal, can cause neonatal conjunctivitis. After how many days the symptom starts to develop in eyes? After 6 hours, 24 hours, within 48 hours, after 48 hours, within 7 to 15 days.
E.
Yes, E is the correct answer. Within 7 to 15 days. Which of the following syndrome is most commonly associated with complication of pelvic inflammatory disease caused by Chlamydia trachomatis? Blue baby syndrome, Fitz-Hughes-Curtis syndrome, toxic shock syndrome, leaky gut syndrome, Ritter syndrome.
E.
B.
No, the correct answer is B, Fitz-Hughes-Curtis syndrome. I have told you it is exclusive of pelvic inflammatory disease, this syndrome, which is also called perihepatitis. So B is the correct answer. This is the key, and thank you so much.
Thank you very much, Dr. Sadia. Very nice presentation. Chlamydia trachomatis is a very common problem, and as you have already presented, that it is an obligatory intercellular parasite, and it is very difficult to diagnose it. There are many clinical symptoms and signs. However, for diagnosis, we need cultures, and cultures need to grow the chlamydia within the cells. And chick embryo intracellular cultures, they are used for chlamydia. We have certain important tests that have been developed recently, and they help in screening of chlamydia trachomatis. However, the gold standard is still the culture. As you have told about the neonates and how it has been transmitted, and the 2 weeks after delivery, they are very important, because after 2 weeks, various symptoms they start developing, and it is very important to monitor the child for possible infection that has been transmitted during birth. There